I wanted to dig in a little bit about your position on Medicare for All. We have great insurance coverage, and even we still have to fight with the insurance companies to get the care that my kids need. So we see even opportunity there for people that are already insured. And I was trying to figure out, because I think you're a wonderful representative, and I've enjoyed being in your district, but I've been trying to figure out what's holding you back, and I was wondering if you could share that, because a lot of the other Congress people in the Bay Area have signed on. Thank you.
Well, thank you. Thank you for being here. I'm glad that Holly is here with you. This is an issue that's raised in almost every town hall meeting, which I think is really important, so that, it's a healthcare, as I said, was the #1 issue in every single congressional district last November. That's a rarity, that one issue is the top issue in every single congressional district. Medicare for All is, in terms of advocates, they see it being only one bill. There are several bills, and they're all Medicare for All. They have different ideas. See, there's someone complaining already. No, that's not true, but it is true. There are other bills. You don't like them, but the fact of the matter is that there are other bills. But the bill I'm sure you're referring to is the Jayapal bill. #1, we don't know what it's going to cost. It has not been scored. #2, I think, now this is my experience with my constituents, is that people like choice. And choice is eliminated in that particular bill. In other Medicare for All legislation, it's, they're structured in another way. But I know that I'm sure that you're referring to the Jayapal bill. #3, I've never taken health insurance away from anyone. I have fought my entire public life, since I was on the Board of Supervisors, to see that we had universal health care. That means everyone has good coverage and good health care, access to it, that they really can get it. I mean, I believe in it. And I haven't just talked about it. You have to go through my voting record and you'll see. It's replete with that. The Jayapal bill removes all employer sponsored health care. Well, with some people, I guess you don't like what you have at work, but there are many people that like what they have. And if they like what they have, I think, it's always a great conversation. So where I agree 1,000% with anyone that wants universal coverage for everyone, I've always been there. I've been there before some of you were born, doing it. So I don't agree with all the elements of that bill. Do I think that people, that we could open up Medicare and have people buy into Medicare at a younger age? Yes. Do I think that Medicare can be strengthened? Yes. I'm taking up bills right now that would lower the co-pays that seniors pay in Medicare, because there's a big gripe there, and legitimately so, because for some they're paying up to $3,500 a year in co-pays. They can't afford that, and you know that Medicare B is 80%. It's not 100%. So this particular bill completely changes Medicare as we know it. And maybe that's what the American people want. There's a mixed view in our district. at least for the people that have spoken to me. And I've met with many groups, organizations, individuals. I've invited them all into my office, but also town hall meetings, also emails, letters that have been handwritten to me. There's a mixture. I think that because we live with so much complexity now, that the idea of something that is simple is absolutely appealing to people. I understand that. I understand that. And we have shortcomings in our system. We have shortcomings in our system. Now, you see even some of our presidential candidates, Senator Harris said, I have a plan, it's Medicare for all, and it'll take 10 years. I have to tell you, I don't think people want to wait 10 years for anything. I really don't. I think that, you know, my preference is that we strengthen the ACA. I see what it's done just right here in our congressional district. I think that we have to make more room for more people to be able to afford it. I mean, the first word is Affordable Care Act. And the middle class in the original structure, because we had to get the votes and then have the money to do what we were doing, that we build on that so that the subsidies move up into the middle class. Middle class is having a rough time today. There's so many deductibilities removed in the big tax bill of last year. So I understand very well and admire the advocates that are out there saying we want everyone insured. So do I. So do I. Do I think that the Jayapal bill is the end all? I don't. I think it gives people hope for what we can look forward to. But I'm troubled about taking insurance away from people. I really am. I've never done that in my public life. I've always added to it. I've always improved it. I've always gone after the insurers and anyone that's in that system that is raking people over or not treating them the way they should be treated. And my record is replete with that too. So I wish people would read about some of the others just to be informed about what else is out there. I believe, do we have it on that Vox piece on our website, Baltazar? Do you know?
Not at the moment.
Well, we should put it out there just so that it's FYI, so that people can see the ideas. And I think it's important. It is a gigantic, it's monumental to take an entire system apart and establish a whole new system all at once. I don't know if you remember the thousands of people that practically came out with rifles at me for the Affordable Care Act. I mean, we had to have so much security at town hall meetings because people were so opposed to that. And now that it has walked into people's lives and helped millions of people, close to 30 million people have insurance because of it. And anyone that has a private insurance policy, all the reforms that we did of the insurance industry, you're benefited from what we did. It's not just in the ACA. So, but I think on the pharmaceutical side, direct negotiations, on health coverage and what the benefits are, and that people will have those for a lifetime and they can afford it. I mean, I've met with so many of the advocates. I said, well, you know, do you think that we're ready to have doctors and nurses to be all federal employees? I think, well, read the bill. Have you read it? Have you actually read it? I'll go to the sections. I'll go to the sections in the interpretation. I've taken it apart, put it back together again. I'm not saying this to offend people. We have to know what the promise is, that everyone will have everything covered from birth to the grave, and The advocates tell me there will be no premiums. So my question is, I have to tell you how I vote, how I pay for things. It's a legitimate question to say, so then how do we pay for this?
By cutting out the middleman.
Well, that's, yeah. No, yeah. Well, you know what, what you're shouting out at me, trust me, it's been shared with me before. And I don't want you to think that I ignore that. I know that's what you think. There has to be a lot more professional thinking about this. From the Kaiser Family Foundation, they do excellent analysis. We're going to have to get a score on the bill in terms of how it's written, what it will cost. Then it's up to people to figure out where you're going to get those resources from. And what you shouted out, take the middleman out, there has to be an analysis of what that costs and the elimination of it and how much of the legislation it pays for. And these are the steps we have to go through. Pardon me?
Several studies already. University of Amherst has made a study, the Koch brothers funded a study, and they repeatedly show that this saves money. Well, the Koch brothers, there you go. They didn't want you to see that.
Yeah. Well, you know what? I welcome the debate. I'm not running away from the debate. And I think that there have already been 2 committees in the Congress that have had hearings on this. At some point, I'm sure that we will. And what? Yeah, that's what I'm saying. Yeah, at some point there will. We have to get direct negotiations done. We made a promise to the American people. We're going to keep that promise first. But there should be hearings so that the American people are a part of this. Look, this is going to be part of the presidential debate. It's going to be part of the presidential debate. It already is. The different candidates have different plans. And the fewer candidates we have, they're going to have to really explain their plans. And then Mr. Trump is going to come landing on them too. So where I think there's a vulnerability, and this is a little bit of politics, which maybe I shouldn't do, but we're moving into that season relative to the politics of the policy. I worry about him going out and saying, how many of you have insurance where you work? People raise their hands and say the Democrats want to take it away from you. And I think that's a tough one because it's about 160 million people in our country. That's more than a handful of votes. So anyway, thank you for asking it. And I'm saying back to you where we need to make the examinations. I also think that people should make themselves open their broaden their vision about the different ideas that there are out there, and the authors of those bills consider them Medicare for all too, but they do things in a different way. And we'll make sure that they're very simple. I mean, it's not my writing, it's out of Vox, and I think I've passed it out to members, and they've enjoyed reading it because it's simple. It's very simple, it's very clear what it does, what it doesn't do, what each one of these plans do. And then you'll tell me what you think. Do I think Medicare for All is going to come up for a vote this year? No, because it really hasn't matured. There's marvelous on-the-ground advocacy for it. There really is. And I think, again, the idea that you just go to one place, the federal government, and you get everything. And I don't know what it's going to cost, but the advocates have said there will not be any premium. So I don't know. Is it going to be a payroll tax? I don't know. I'm not sure. I didn't find that in the bill. It doesn't specify anything relative to how it's going to be dealt with. But that's not fault or blame. It's just it's this iteration of the legislation. It changed from the last Congress, changed from the last one. So thank you for asking it. Everybody shouted out what they want to shout out. I hear you, but I have questions about it. And I think it's healthy too. I think it's healthy to have questions, and the questions need to be answered. We need to, so that I can say to you, this has been examined, this is the best source, this is a nonpartisan evaluation of the legislation, and then you decide whether you think you're for it or you're not for it. Well, there'll be hearings, yes. Yeah, there will be. There'll be hearings. There will be hearings, sure. You know, I can't give you a date. We have to complete the work that we have before us. We have to make good on what we promised the American people we would do. And as long as I'm there, I'm going to press on that. I think that promises made should be promises kept. And I held a members' day so that any member of Congress, Republican, Democrat, could come and speak about their legislation before the committee. And there was only one member that came to talk about Medicare for all, but it wasn't the Jayapal bill. It was the Schakowsky DeLauro bill. I was so surprised that no one came and made use of that time on this particular subject, because I hear from you, but I was stunned that, I mean, you here at home say, have a hearing, when are you going to have a hearing, what's the date, do it right now, and here opened it up to the whole Congress to come and testify about their legislation, and they didn't. Only, as I said, one came, but it was another bill, another Medicare for all bill. And it was good. I mean, it was a good conversation, excellent presentation of it. Next question.
So, yeah, exactly. It's 8:30.
Right?
This will be the last question.
Okay. Well, maybe we'll squeeze another one in, but.
My name is James. I live in Portola Valley. I'm a physician seeing patients. I also spent decades analyzing the diseases of this country. Since I only have one question to ask, I have to ask about this fundamental disease which makes everything else impossible. Actually, FDR talked about Medicare for all in 1944. In 1945, a State Union speech, he talked about one thing, peace, which means no peace, no health care. And so this is a question. When can this country stop pursuing its imperialistic goal under the influence of military-industrial complex?
I don't think I understand the question.